Welcome to your recovery and discharge education class following your hip or knee replacement surgery. This information is a review of the content in the guidebook to hip and knee replacement that you first got when you met with your surgeon and his nurse. This is the book you've been using to do your exercises before surgery. Please keep the guidebook handy at home for easy reference as you recover. The information will be reviewed again with you by your nurse. It will also be printed for you on the after-visit summary that you will be given at discharge when you go home. Pain management. First, let's talk about pain management. After surgery, your main goal is to feel better. Pain relief plays a big role in your recovery. Less pain means less stress on your body and your mind. When you're relaxed, blood flows more easily and healing is faster. It will help you heal if you know what to expect, tell others what you need, and use your pain medicines as directed. Because your comfort is important to us, your nurses have been asking you to rate your pain on a scale of 0 to 10. 0 means that you have no pain, 10 means you have the worst pain you can imagine. Rating your pain helps you and your healthcare team to know how much your pain medicine is helping you. We will ask you to choose a number on the pain scale from 0 to 10, and by asking you this, you're setting a pain goal. Ask yourself, where on the scale do I feel comfortable? Don't set your goal at 0. Having no pain is not a realistic goal. Pain medicines will help to make you more comfortable, but they may not take away all the pain. To prevent nausea, don't take your pain medicine on an empty stomach. Eat some type of food before taking the medication. Contact your surgeon if you continue to have nausea with your pain medication. Having pain doesn't mean you should stop your physical therapy. Taking pain medicine beforehand will make it easier for you to do the exercises. It's important to take your pain medicine as prescribed. Taking more tablets at one time or more often than directed may cause you to become overly medicated. If your pain medicine isn't effective in controlling your pain, contact your surgeon. You may want to use a chart to keep track of your medications, which type you're taking, how many you take, and how often. As you get farther along in your recovery, your need for pain medicine will decrease. You may gradually cut back to taking pain medicine for therapy and for sleeping at night. This will be discussed at your first post-op appointment. Don't drink alcohol or drive as long as you're still using the prescription pain medication. Don't take additional acetaminophen or Tylenol if you're taking the medications Norco or Percocet for pain or using any other medications that contain acetaminophen. The current Food and Drug Administration recommendation is that no more than 4,000 milligrams of acetaminophen be taken daily. You will be given prescriptions for pain medications before you leave the hospital. You may have these prescriptions filled at the Essentia Health pharmacy and delivered to you before you are discharged. Refilling your prescription medications. It's important to plan ahead for your pain medication refills. Call at least 3 to 4 days before you will run out of the pain pills. Some prescriptions can be called in or sent into a pharmacy. Others require a written prescription. Strong pain medications such as oxycodone and Dilaudid can't be called in. These medications require a written prescription every time they are refilled. Someone will need to pick up the written prescription for you at the orthopedic clinic. The written prescription may also be mailed to your home or to your local pharmacy. Be aware of when you will run out of strong pain medication. Plan ahead to allow time to have the prescription mailed to your home or pharmacy, or for the pharmacy to mail you the filled prescription, or even for someone to come to the Duluth Orthopedic Clinic to pick up the written prescription. This cannot be done on a weekend and possibly not on a Friday. Swelling. There are other things that can cause pain after surgery. One of them is swelling of your surgical leg. Swelling is normal and can continue for weeks, and it is one of the main causes of leg stiffness and pain. To prevent and reduce swelling, rest for short periods throughout the day. Lie flat on the couch or bed and place 4 or 5 pillows under your entire surgical leg to get your foot higher than your heart. Keep your leg raised above the level of your heart for at least 30 minutes at a time and for at least 3 times each day. You can elevate more often if you have more swelling. You must lay on your bed or your couch. A recliner chair does not raise your foot higher than your heart. Place an ice pack on your surgical area for 20 minutes at a time. Do this 3 to 4 times per day, before or after exercising, for as long as you have pain and swelling. You can also continue to wear your compression stockings beyond the required 5 weeks if you continue to have swelling of your leg. You may also have bruising of your surgical leg. This bruising usually peaks at about 3 to 5 days after surgery. You may notice the bruising on the front or back of your leg, even down to your ankle, foot, and tops of your toes. This is normal post-op bruising. It will be reabsorbed by the body, usually within the first 2 weeks. You may also experience frequent urination as you recover. This is common and is a way your body rids itself of the extra fluids you have accumulated during and after surgery. If you have pain, burning, or difficulty with urination, contact your primary care provider. Some people don't sleep well for several weeks after surgery. Pain may seem worse at night and disturb your sleep. A pain pill at bedtime may help. If you're napping during the day, you may not need as much sleep at night. Your appetite may be decreased for the first few days after surgery. Drink plenty of fluids to keep from getting dehydrated. You may eat your usual diet as you feel up to it. Good nutrition is important for your recovery, and eating healthy foods will help you heal and feel your best. Inactivity and strong pain medications will cause constipation. This constipation will continue as long as you're taking those strong pain meds. To prevent constipation, increase the fluid intake and the fiber in your diet. Increase your activity to counteract the constipating effects of the medications. You may want to use a gentle stool softener such as Senecot S or Docusate Sodium. You can buy these over-the-counter medications at your local pharmacy if not prescribed for you at Discharge. Continue to use a stool softener until you're having regular bowel movements or while you are still taking the strong pain medication. Don't use bulking agents like Metamucil. This could make your constipation worse. Call your primary care doctor if you have constipation issues at home that are not relieved with stool softeners and diet changes. Your incision. Be sure to look at your dressing before you leave the hospital. Your incision is covered by a gauze and clear plastic dressing. This dressing should remain in place until your first post-op appointment. It does not need to be changed. If the dressing edges loosen, if the dressing falls off, or if it becomes soil or saturated with blood or drainage, call your surgeon's office. In the meantime, keep the incision clean, dry, and covered. If you have staples closing your skin, they will be removed at your first post-op visit. If you have steri-strips closing the incision, they will fall off on their own. You may shower after surgery when you feel strong enough. Your dressing is water resistant and you may shower with it in place. You can also cover it with a plastic wrap such as Glad Press and Seal. Pat the dressing dry after showering and check the edges for any leakage. If water has leaked onto the gauze, call your surgeon's office. You should not take a tub bath, use a hot tub, or swim in a lake or pool until the incision is well healed and a scar, not a scab. Blood clot prevention. A blood clot is a complication that may occur following surgery, especially a joint replacement. A deep vein thrombosis, or a DVT, occurs when a blood clot forms in a deep vein. The most common place for a clot to develop is in a leg. A DVT can occur in either leg, not just your surgical leg. Signs of a blood clot in the leg are swelling in the thigh, calf, or ankle that doesn't go down after elevating your leg, and you may also have an unusual pain, heat, or tenderness in the calf, thigh, groin, or back of the knee. A pulmonary embolism, or PE, is a clot that breaks loose and travels to the lungs. Some signs of a blood clot in the lungs are sudden shortness of breath, sudden chest pain, coughing up blood, a rapid heart rate, and confusion. To prevent a blood clot, your doctor has prescribed an anticoagulant medication, usually aspirin or warfarin. This medication was started the day of surgery. If you are taking aspirin, you will take an aspirin tablet twice a day for a total of 35 days from your surgery date. This aspirin is for blood clot prevention, not for pain relief. At 35 days or 5 weeks after surgery, either return to taking your regular aspirin dose or stop taking aspirin if you were not using it prior to surgery. If you are taking warfarin or Coumadin, you will need to have an INR blood test drawn twice a week to determine the correct medication dose. A nurse will contact you to review the test results and your next warfarin dose. You will talk with a hospital pharmacist before you discharge to receive more education about warfarin testing, dosing, and to schedule your first lab appointment. Do not take additional NSAID or anti-inflammatory medicines such as ibuprofen, Motrin, Advil, naproxen, Aleve, or any additional aspirin while taking your anticoagulant medication unless your surgeon or his nurse says that you may. This could cause stomach irritation. You can also reduce your blood clot risk by wearing your white compression stockings. Wear these stockings during the day on both legs for 5 weeks from your surgery date. The stockings should be removed at night. Ankle pump exercises and frequent short walks improve circulation so that the blood flow doesn't slow down enough to form a clot. When resting in bed or sitting in a chair, do your ankle pump exercise 10 to 30 times each hour. Get up for a short walk at least every hour, and when riding in the car, stop every 60 to 90 minutes to stretch and walk. Infection prevention. We're all doing many things to prevent an infection around your incision and in your new joint. The risk of infection after surgery is low, however, that risk follows you for the rest of your life. Bacteria from other areas of your body may travel through the bloodstream and settle in your joint. Cuts or puncture wounds can become infected and possibly send bacteria to the joint. An infection in an artificial joint is a serious problem. Antibiotics alone may not cure the infection. The joint may need to be removed for several months until the infection is cleared. Then another joint would be placed. To prevent an infection at your surgical site, don't touch your incision until it is healed. Don't put lotions, creams, ointments, or sprays on your incision until it is well healed and scarred. If you develop a cut or puncture wound, clean the area thoroughly. Watch carefully for redness, drainage, a fever, or other signs of infection. And tell your primary care provider and your dentist that you have had a joint replacement. You will want to contact your surgeon with any of these signs of infection. More swelling and redness around the incision, a change in the color, in the amount, or an odor to the drainage from the incision, more or unusual pain in your leg, an open spot on the incision, a fever greater than 100 degrees for at least 24 hours. Keep in mind a mild fever in the first few days is common, or if you have chills with a fever. Don't have a routine dental checkup or cleaning done for at least the first 3 months following a joint replacement. If you have a dental emergency and need to see your dentist within those first 3 months, you may have a higher risk of developing a joint infection from bacteria in your mouth traveling through your bloodstream to your new joint. In this situation, you must take an antibiotic 1 hour before the dental appointment. Some people may have a higher chance of developing an infection because of other health reasons. Your orthopedic surgeon will discuss this with you to determine if an antibiotic is needed before any dental work after the initial 3-month post-op period. This will be reviewed at your post-op appointments. Your orthopedic surgeon or your dentist will prescribe the appropriate antibiotic if needed. Contact them before your dental appointment or with questions. Exercising. It's important to exercise and be active after a joint replacement. Do your breathing exercises to help open up your lungs and prevent pneumonia. Take your incentive spirometer home and use it every hour while you are awake for the first 2 weeks. You will also want to do your knee and hip exercises. Do your home exercise program twice a day, every day, as instructed by your physical therapist. These are the same exercises that are listed in the guidebook to hip and knee replacement, which you were doing before your surgery. Your physical therapist will give you more instructions about the home exercise program and your activities during your physical therapy classes. As you recover, it's important to stay in touch with your orthopedic surgeon with questions or concerns. Please contact him with any of the following symptoms: a fever of 100 degrees or higher for 24 hours, or chills with a fever. If you have bleeding from your incision that's leaking out of your dressing, if you have an increase in the drainage or a bad smell from the incision, or if you would develop an open area on the incision. If your pain pills cause nausea and vomiting, or if your pain pills don't control your pain when you're using them as directed. Also call if you were to develop numbness or tingling in the surgical foot or leg. If you stop making progress with your physical therapy, such as a decrease in your ability to bend your knee, or have increased pain with doing your exercises, please update your surgeon. Any fall should also be reported. And if you were to develop any symptoms of a blood clot in your leg, such as swelling in the thigh, calf, or ankle that doesn't go down after elevating your pain, or have pain, heat, or tenderness in your calf, thigh, groin, or back of the knee, please contact your surgeon's office. Call 911 if you develop chest pain or sudden shortness of breath or any other symptoms of a blood clot in your lungs. Contact your primary care provider if you have questions or concerns related to any changes in your general health, such as diabetes, heart disease, or questions about medications for chronic medical conditions. Also call if you have symptoms of a bladder infection, such as pain or burning when you urinate. Before you leave the hospital, your nurse will review these recovery instructions, your medications, and your post-op appointments with you and your family. These instructions will also be printed for you on your after-visit summary. Please keep the instructions close by for you and your family to review at home. The information is also outlined in your guidebook for hip and knee replacement. Keep this book handy to review at home. You may also find the answer to many of the questions you will have in this guidebook. If the answer isn't found there, please contact your surgeon. Thank you for your attention today. If you have any questions about this information, talk with your nurse. The education is available at any time for you or your family to view and review again.